right, we're recording here live at the Healthcare Marketing and Physician Strategy Summit here in Las Vegas, here in the Expo Hall. And I'm with someone that I have just met, but it sounds to me like you and I might have additional conversations as we move to the future. And that's Tom Kruse with Virginia Mason Franciscan Health. Welcome.
Thank you. Pleasure to be here.
I'd love for you to share before we get into, talking about things today. Share a little bit more about you, your role, and, and then we could get into what brought you here today.
Sure. So I'm the Chief Strategy Officer for Virginia Mason Franciscan Health, which is one of 5 divisions of Common Spirit. So we're about a $4.5 billion system in the Pacific Northwest with hospitals and providers in Washington and Oregon. And we serve about 3-4 million people a year. So we're really proud of what we've done.
That's great. That's great. Now, this conference typically attracts people from the marketing and physician side, but we're starting to see more and more strategy officers come. This is probably your first experience here. So what,
it is.
And you came and presented. I'd love to hear a little bit more about what you presented about and get some impressions of what you're feeling about just other things that you're seeing at this conference.
Sure.
So let's start with
from what I've seen, this is great. This is it's neat. My whole career, I've had a blend of strategy with marketing and community relations and sales and all the different arms that engage consumers in a meaningful way before, during, and after their healthcare journeys. And what we're finding, I think, as the industry continues to evolve, is more and more of a merger of those work streams, so that the strategy is more and more about consumer engagement in an authentic place, because consumers are getting smarter. They're bringing data to the table. They're bringing Dr. Google with them. They're coming with opinions about what needs to happen, and increasingly the financial systems are driving them to be more and more financially accountable for those choices. And so to see the sales and the marketing and the strategy starting to really merge in the tactical world of how we engage people is really optimistic for me and for my own team, but also I think to see the whole industry coming together in that way. This is very encouraging.
Yeah, it's one of the themes, right, of this conference is like seeing how that we're now working with more people more interactively. I've been in this space for a number of years, right, and there's been a lot of siloing.
Yeah.
And now we're seeing it all come together because we need to. This is the new imperatives. Our industry is facing a lot of challenges right now.
Many challenges. And that's part of what we presented about just a short while ago, was myself and Kathy Smith from Roper St. Francis in South Carolina talking about really a couple different vantage points on partnering with sports teams, whether that's high school and local versus collegiate versus professional. And how do you actually drive value and use that as a tool to engage the consumer in a way to talk about their health care and advocate for themselves and to educate themselves in a way that they feel passionately energized about, because it's engaging with their sports team, which they have a personal passion. They're a fan in many cases, and so they're very engaged in taking action and self-educating in a way that non-fans wouldn't be quite as compelled to do so by a system that's saying, we're the health system, do what we asked you, or you should try this. That's not quite as memorable as wow, my favorite professional athlete just told me that this is what he did for his mom, and that made a big difference in her life, and so I'm going to check that out. And so we're seeing that this is a real tool that healthcare systems can use to almost to have that third-party validation from something that people already have a passion and love for, and to be able to drive people to better accountability and smarter healthcare choices.
Yeah, it makes so much sense. And, I'm going to use a term that often has maybe a misaligned name to it, but the sports partnerships are really an extension of like influencers in the marketplace or community members, right? So being able to work with them, partner with them, that can deliver the message and the vision and the mission of what you're trying to accomplish at your organization in a very authentic way through this third party. It's really like an influencer strategy if you think about it.
I really like that. I won't profess to be a great understander of the world of influencers, because I'm not, but I think the parallels you're drawing are really accurate.
Yeah, and that kind of speaks to the new world, right? Is that we are seeing in this industry that the consumer is the trust within a health system. While it's still very strong, it's slowly starting to erode and go to other places. the more we can do to align to build that trust back up, it really meets our mission, doesn't it?
It does, that's why we called it the kind of the core philosophy behind these partnerships is the transfer of trust.
Wow.
Where there's trust there, we want that trust to be with us, but if we just ask for it, it's not going to transfer the same way. But we're able to successfully bring it over, and so we've had a lot of success with it. We've partnered with groups like Playbook for Health, who's also here for many years, and they've helped us do it, but also do it in an accountable way, because I think that's where there's whether you're a marketer, strategy, or sales or whatever, there is a constant pressure, downward pressure on the industry to cost less and to use resources more sparingly to accomplish the same or more. And so we have to be accountable with these, in some cases, big dollars that go into these investments and these partnerships. It can't just be access to tickets and T-shirts and things like that.
Right.
It's got to be something that actually delivers on our mission and our vision for the community.
I love that. I really love that. And that kind of reflects the current state that we're in, because our industry is facing that's tremendous pressure, as you indicated. Okay, so now I'm going to ask you, right, looking into your crystal ball, metaphorical crystal ball right here, as we look forward, we are facing a lot of challenges now. What would you, like a year from now or even 2 years from now, where do you see like our things, what are we going to be talking about? What are the things that are going to be top of mind to us then? Is it still what we're dealing with? Obviously, financial pressures, strategy alignment is a big piece of this. But do you think there's going to be other things that might be coming through that we need to pay attention to?
I think there could be some new. I think we're going to see more intensification of what we have today. Obviously, I spend a lot of my energy in the mergers, acquisitions, partnerships, joint ventures world. And I think you're going to see more and more of that to the extent that the government and other community advocate, structures will allow for it. There's an intolerance for monopolistic, thing. It doesn't help the consumer. It doesn't help the community, and I think everyone would agree with that. But there's a fine line between adding value and abusing that scale and scope. At the same time, there's many organizations that come to me and they say, we can't afford to serve our community. We can't afford to offer this scope of services without a partner, without some help. And so I think you're going to see more of that. But it's all focused around this notion that there is a downward pressure on cost, and this industry has to cost less. We simply can't. Everyone has seen the graphs. We cost more than many, and our outcomes don't justify that expense. And so something's got to happen. Either we have to have outcomes that parallel the incredible expenditure, or we have to cost what's appropriate. And I think the piece of that hasn't been addressed, that I don't know where in society this is going to get brought up, probably by somebody who doesn't want to be elected again, is there has to be a conversation around individual accountability.
Yeah.
People still are insulated too much from the cost of the care, the choices that they're making. They're still choosing what they prefer, what they think is the most conservative, what's the safest. Doctor, I want the MRI. Yes, I want the prescription, even though the doctor says I don't need it. I want to be admitted overnight for observation, even though the doctor says I don't need it. I'm going to the ER when I know I could wait till the morning and go to my primary care physician. I could get a primary care physician instead of just going to see a specialist. Those kinds of choices have to get metered in some way, or the industry can't afford itself, and the American public and the employers are tired of paying for it. And so, with medical bankruptcy being where it is, we're not doing our communities a service when we're bankrupting people while we're insulating them from the knowledge of what the smart choices are. So I think you're going to see a lot more activity, probably from the people at this conference, engaging people around wise but safe and responsible choices for them and their family that are also the fiscally proper thing to do.
Tom, I love the way you took a very critical challenge of our industry and you have a positive angle towards this, because I feel there's a lot of hope and optimism in our industry that we can transform what we need to do. We need to.
There has to be.
We've, over the last couple of years, right, even through the pandemic, we rose to the challenge. We're going to rise again. Do you agree?
I do. There's a lot of businesses you can work in. If you want to work in healthcare in the United States, if you can't come to work every day and figure in your brain, process it and say, I'm here to figure out how to make this better for the people that we serve, if you can't actually take it down to the patient level, you either got to readjust yourself, or you should think about a different business, because that's the privilege of working in this business. Is that's what we do. That's why we're here. And the minute you forget that, this just becomes a really hard, stressful job.
Yeah.
And I think the thing that gets most of these people up every day is it's a hard, stressful job, but it's very rewarding. And there's individual stories that come out of it that are just, that bring a tear to your eye. They're amazing. The things that you hear about, that the person that's lives that's saved, the screening that we held recently with our partners at the Seahawks is 600 children for pediatric cardiac issues. One of those kids was literally at the stage where he could have been a patient in the next 2 weeks that had a bad outcome. And so if he hadn't been there. And so knowing that we did something through this partnership that actually yielded one child that literally could have died in a couple weeks, makes it all worthwhile.
Makes it all worthwhile. Tom, thank you so much for spending a few minutes with me. I really appreciate the conversation.
Thank you.